7 symptoms of heart attack 1 month before. Are you aware that every 40 seconds, someone in the United States experiences a heart attack? Over the past decade, there's been a noticeable increase in heart attacks, particularly among individuals under 40 and women. Surprisingly, 1 in 5 women is at risk of experiencing a heart attack. According to international health authorities, cardiovascular diseases are responsible for over 17 million deaths annually. That's over 30 individuals every minute, surpassing fatalities from cancer and traffic accidents combined. The insidious nature of these diseases lies in their silence. Often, we only become aware of the danger when it's far too late. This is largely because the critical early warning signs preceding a heart attack are not widely known. Today, we will discuss together the reasons behind the rising number of heart attack cases. We'll delve into why this alarming trend is affecting younger populations, including both men and women, and even those who previously showed no signs of cardiac issues. Often, heart attacks strike when least expected, underscoring the need for awareness and preventative measures. Let's discover the 7 signs your body might exhibit a month or just days before a heart attack. Stay tuned until the end of this video, as I'll also unveil the factors contributing to the alarming rise in heart attacks among individuals under 40. If you recognize any of these 7 symptoms, you might be only days away from experiencing a heart attack. It's crucial to consult a cardiologist immediately, as any delay can lead to irreversible damage to the heart. Let's begin with the first symptom of a heart attack 1 month before. Symptom number 1: cold sweat and paleness. In fact, up to 30% of individuals who've had a heart attack reported experiencing this in the days leading up to the event. But what sets this apart from normal sweating? When experiencing a cold sweat related to heart issues, it appears suddenly and is markedly different from the sweat produced when you're hot or engaged in physical activity. It's sticky and cold, often accompanied by a feeling of chilliness on the forehead or throughout the body, and you might notice a sudden paleness in your skin. This symptom can come and go, resolving spontaneously within a few minutes, and it can occur at any time, while at rest, eating, or during any routine activity. What's more, it tends to happen repeatedly before a heart attack occurs. If you notice this kind of cold sweat and paleness, especially if it happens multiple times, it's crucial to take it seriously. These are not ordinary symptoms. They could be indicating that your heart is in distress. Seeking medical attention promptly could be vital in preventing a heart attack. Symptom number 2: fatigue or short of breath. This symptom is critical. A staggering 70% of women who have experienced a heart attack reported feeling fatigue or short of breath in the days or even hours leading up to the event. This isn't ordinary tiredness. It's similar to flu-like fatigue, but without the accompanying cough, fever, or sore throat. Such profound weakness or muscle fatigue, especially if it's a new development within the last 30 days, warrants your attention. Pay special attention if you suddenly find yourself short of breath after minor activities like walking a block or climbing stairs, or if you're experiencing an unusual level of exhaustion, disproportionate to your exertion. These signs would indicate clogged arteries, a precursor to a heart attack, even if you don't feel any chest pain. Determining whether your shortness of breath or fatigue is a heart issue or something else like anemia, bronchitis, or just a lack of physical activity can be perplexing. There are 2 critical indicators that suggest your symptoms may be heart-related: a recent and notable increase in symptoms, especially if they are new or have worsened recently, and the presence of heart disease risk factors. The combination of symptoms and your personal health history paints the full picture. Symptom 3: jaw pain. This one requires your careful attention. Just as tingling in your leg might indicate spinal issues, or shoulder pain might be linked to your gallbladder or liver, pain in your jaw, particularly on the left side, could signal a heart problem, possibly warning of an impending heart attack. This phenomenon is due to the way our bodies are wired. As we develop in the womb, our organs form with nerves that originate from other parts of the body. As a result, when we're adults, our brain can sometimes get confused about the source of pain. So, If you experience unusual or persistent jaw pain, especially if it's on the left side, consider it a potential warning sign. It's not just about where the pain is, but understanding that sometimes pain in one area can indicate a serious issue elsewhere. Remember, while jaw pain can have many causes, if it's accompanied by other symptoms of a heart attack or you have risk factors, don't take it lightly. It's always better to be cautious and seek a cardiologist urgently, especially if it is accompanied by the other signs I'm going to tell you about. 4. Digestive discomfort. This symptom is particularly prevalent among women and the elderly. It's not just any stomach pain, it's a pain that might mimic gastritis but isn't. You might notice stomach bloating during or after meals, or even pain while walking or exerting yourself. These are the moments when it's crucial to consider that the root cause might be your heart, not your stomach, especially if you fall into the high-risk categories for atherosclerosis, being over 50, though it can occur at any age, having diabetes, high blood pressure, obesity, especially excess visceral fat, smoking, or regular exposure to secondhand smoke. You need to be extra cautious. If this resonates with your experiences, especially if you have the mentioned risk factors, I urge you not to dismiss these signs. They could be the early warnings your body is giving you about an impending heart attack. Early detection could be the key to saving your heart and potentially your life. Don't underestimate these symptoms. 5. Back pain. Pain around the scapula or the lower part of the neck, especially on the left side, was a precursor to a heart attack or indicated a problem with the aorta artery, one of the largest arteries in our body. It's easy to dismiss this as mere muscle pain, but here's where you need to be cautious. If the pain doesn't improve with changes in position or self-massage, it could be signaling something more serious. Unlike typical muscle soreness, this kind of pain is persistent and doesn't respond to usual remedies. The aorta is responsible for delivering blood to almost all parts. Diseases that weaken its wall can lead to the formation of ulcers or tears, resulting in very intense pain between the shoulder blades. Such aortic issues are medical emergencies and require immediate attention. If you're experiencing this type of back pain, particularly if it's a new symptom and doesn't respond to typical treatments, it's crucial to consider the possibility of a heart or aortic problem. The nature of the pain associated with heart or aortic issues is distinct and severe. In the case of aortic problems, the pain is intense, feeling as if something is piercing you from the front of the chest straight through to the back. However, when the pain is related to a potential heart attack, it tends to be milder but still significant, more like a persistent pressure in the back. It's usually not constant. Instead, it comes and goes, generally lasting only a few minutes at a time. Experiencing this type of pressure-like back pain? Don't dismiss new or unusual back pain. It could be your body alerting you to a serious condition. 6. Numbness of the left hand and arm. Over the past month, have you experienced a slight pain or numbness in your left arm and hand, especially during activities like walking or climbing stairs? If so, take it as a potential warning sign. While it's true that various health problems can cause such numbness, it's crucial to consider the context. If this symptom is new to you, if you possess the risk factors for heart disease that I've previously mentioned, and if there's no other logical explanation for this sudden change, then it's time to take action. If you're at risk for heart problems, consulting a cardiologist could be a vital step. 7. Dizziness. Beware of sudden dizziness, feelings of faintness, or episodes of low blood pressure that appear out of the blue. These symptoms, especially if they've started recently and occur during physical exertion, like walking a block, climbing stairs, or even while eating, should not be ignored. Many patients who experience these symptoms and are later found to have significant heart issues undergo cardiac catheterization. This diagnostic procedure, which involves administering contrast to visualize the coronary arteries, often reveals that the obstruction is nearly complete. Why do heart attacks occur? It all starts with the heart's vital role, pumping nutrient and oxygen-rich blood throughout the body, including to the heart muscle itself. The coronary arteries nestled in the heart's walls are tasked with delivering this blood directly to the heart. A heart attack, also known as acute coronary syndrome, happens when these crucial arteries become blocked. This blockage can arise from various factors, including cholesterol buildup, calcium deposits, and inflammation in the artery walls, all of which hinder the free flow of blood. The primary culprit behind these blockages is often atherosclerosis, a condition where the arteries harden and narrow. What makes atherosclerosis dangerous is its silent nature, often presenting no symptoms until it's too late. Atherosclerosis is similar to a slowly growing plaque of cholesterol and inflammation within your artery. Over the years, this plaque can gradually obstruct blood flow, potentially leading to heart attacks or sudden death if left unchecked. Heart attacks can occur from partial artery blockages as well, where inflamed plaque ruptures, leading to a clot that suddenly blocks blood flow, causing a heart attack. Before a major heart attack, you may notice pre-heart attack symptoms due to temporary blood and oxygen shortage to your heart, signaling the potential for a more serious event soon. Often, these symptoms appear during moments of stress or high emotion, like during a fright, an argument, or intense physical exertion. Poor sleep or any situation that significantly accelerates the heart can also be a trigger. However, remember, these symptoms can arise at any time, day or night. Stay alert to any unusual physical changes, especially if they occur during or after the situations mentioned. Recognizing these signs early on could save your life. How can you distinguish between a pre-heart attack and an actual heart attack? When a heart attack occurs, it means that a part of the heart muscle has been irreversibly damaged due to a lack of blood supply. Individuals experiencing a heart attack report a persistent tightness or a sensation of pressure in the chest. This discomfort lasts for an extended period, often many minutes, and doesn't simply fade away. Furthermore, a heart attack may bring additional distressing symptoms such as nausea, vomiting, a sense of general malaise, shortness of breath, or even an intense feeling of impending doom, often accompanied by a cold sweat. The critical difference lies in the duration and severity. A pre-heart attack typically lasts only a short while, maybe 10 to 15 minutes. Often it quickly improves when the person rests, sits down, or takes a vasodilator tablet under the tongue. If you've been experiencing any of these symptoms, consider them not just as warnings of potential clogged arteries, but also as a reminder that there's still time to act and save your heart. At the first sign of these symptoms, it's imperative to seek medical help immediately. Go to the emergency room, call an ambulance, and inform a family member. Remember, in matters of the heart, every second counts. Over the last 15 years, heart attack hospitalizations in those 39 and younger have increased by over 60%, particularly in women, with deaths rising by more than 10%. This surge is linked to the growing prevalence of atherosclerosis in the young. Modern life, which makes many tasks more convenient, has its drawbacks. With just a tap on our phones, we can easily order fast food. Heart attacks can be prevented by simply modifying a few lifestyle habits. If you smoke, make it a priority to quit. Stopping smoking can reduce your risk of a heart attack by 30%. Keep your blood pressure under control. Are you diabetic? Ensure your blood sugar levels are well managed. Adopt a healthy diet to significantly decrease your cardiovascular risk. Limit ultra-processed foods and increase your intake of fruits, vegetables, and whole grains. Cut down on sugar and incorporate more olive oil into your meals. Are you dealing with high cholesterol? Seek treatment. If you're dealing with obesity, prioritize weight loss. Leave the chair behind and embrace activity. Also, ensure you're getting quality sleep. Aim for 7 to 8 hours per night. And importantly, get a regular cardiovascular checkup. Cardiovascular diseases shouldn't even be among the main causes of death globally, yet today they top the list. Let's each do our part to change this narrative by taking these preventative steps seriously and prioritizing our heart health. Have you or someone you know exhibited any of these symptoms before a heart attack? Leave your comment below. Share this video with your friends and family. You could save a life. If you haven't subscribed yet, subscribe to our channel. Also, allow the notifications so you don't miss our upcoming videos. And what will be the next video you watch? I'll leave 2 recommendations here. Your engagement helps us a lot to continue growing. See you in the next video. Bye.